Hello everyone. We are in a hyperendemic situation where dengue illness should be considered as one of the differential diagnoses in every single patient who present with febrile illness. Early detection by both the families and primary healthcare physician is really life-saving. Dengue is a viral infection which is transmitted by mosquitoes. In fact, it's a spectrum of symptomatic disease where two most significant clinical entities are dengue fever and dengue hemorrhagic fever. These two are really hard to differentiate in early phase. Dengue fever is generally the commoner, milder form of the disease. It typically consists of a brief febrile phase followed directly by the convalescent recovery phase as the infection clears. Dengue hemorrhagic fever, on the other hand, is a much more severe and potentially life-threatening condition. The hallmark of the dengue hemorrhagic fever is a period of transient plasma leakage which is known as critical phase followed by the febrile phase. The febrile phase, which marks the acute onset of a high-grade fever that typically lasts anywhere from 1 to 7 days. During this initial stage, dengue fever and dengue hemorrhagic fever look exactly the same as previously mentioned. Patients commonly experience severe body aches, facial flushing, diffuse skin rash, headache, retroorbital pain, joint pain, nausea or vomiting. It's important to note that currently in Sri Lanka, many patients may not show all these features. Clinically, if a patient has a fever plus at least two of these symptoms and signs, along with a drop in the white blood cells with or without platelets, we consider it as a probable dengue illness. It's important to remember that even if a patient has respiratory symptoms like cough or runny nose, we cannot rule out dengue and must be monitored with serial full blood count. The second stage is the critical phase, which is only seen in dengue hemorrhagic fever. This is caused by increased vascular permeability where fluid leaks out of the blood vessels into the chest and abdominal cavities. This phase begins precisely as fever starts to drop. For a patient with dengue hemorrhagic fever, this critical period of plasma leakage typically lasts for 24 to 48 hours. This can be accompanied by abnormal bleeding, rapidly leading to severe complications. Importantly, the risk of entering the severe dengue hemorrhagic fever state is significantly higher in individuals who have had a previous dengue infection. When do we suspect the critical phase? When the patient has hemorrhagic manifestations, tender hepatomegaly, thrombocytopenia of less than 100,000, leukopenia of equal or less than 5,000 with lymphocytic predominance, rising hematocrit, presence of pleural effusion or ascites. It can be detected by real-time ultrasound scan. If left undiagnosed and unmanaged during this short window, the massive plasma leakage will lead to hypovolemic shock, which is known as dengue shock syndrome, which can be fatal. These are the warning symptoms of impending shock, such as persistent vomiting, severe abdominal pain, restlessness or altered consciousness, postural dizziness, noticeably reduced urine output. Bleeding, if occurs during the early phase, is usually due to drugs such as NSAIDs. Bleeding during the critical phase is usually due to DIC and liver failure, which occurs as a consequence of prolonged shock causing multi-organ dysfunction. Minor bleeding can also manifest as mucosal bleeding, nose bleeding, and as tiny red spots on the skin called petechiae. Bleeding can become exceptionally heavy and dangerous, especially in the gastrointestinal tract if a patient has an underlying peptic ulcer or has been taking medications such as aspirin, NSAIDs, or steroids. This profuse bleeding can also lead to shock. For diagnosis during the early febrile phase, a rapid NS1 antigen test is commonly used in the first 3 to 4 days of the fever. But please remember, a negative NS1 result does not exclude dengue if the clinical symptoms are highly suggestive. Anti-dengue IgM antibody is usually detectable by day 5 of the illness or later and persist up to 60 days. IgG antibody can be positive if there has been a previous episode of infection. That will be all for this video. We will discuss about the preventive measures in our next video. Thank you.